Māori have endured barrier after barrier since the arrival of the British Crown and are still dealing with the repercussions, facing extensive inequities and inequalities that are reflected in multiple social indicators. Most importantly in the health sector, which drastically distinguishes Māori disparities between other ethnicities in Aotearoa, New Zealand. Cam et al. 2020. According to Braveman 2014, disparity is defined as a specific kind of difference, namely worse health among socially disadvantaged people, and in particular members of a disadvantaged racial ethnic groups and economically disadvantaged people within any race or ethnicity. Health inequity is defined as systematic differences in health status that are also deemed unjust or unfair because of socially determined circumstances, by Sylvia Pinheiro 2021. Despite the increased knowledge and progression of implications like healthcare policies, acts and strategies, New Zealand still continues to deliver poorer than average Māori health outcomes. Even though a few select conditions have improved over time for Māori, like their cardiovascular mortality rate, which has decreased by 40%, reported by the Ministry of Health 2019, majority of the health statistics still show Māori overrepresented in comparison to non-Māori in being 2.5 times more likely to die from preventable diseases including cardiovascular disease, diabetes, COPD and asthma, reported by the Ministry of Health 2015. This presentation will explore, analyse and discuss why the healthcare system in New Zealand continues to deliver poorer than average Māori health outcomes using critical social justice literature. It will also discuss the current experiences of Māori in hospital healthcare. It will also explore how Te Tiriti o Waitangi, the article Rangatiatanga, has been applied to more effectively meet the needs of Māori patients and whānau in hospital healthcare. Lastly, I'll be discussing my application of Te Tiriti to my practice. When diving back into the early days to understand the complexities that intertwined to create years and years of systemic racism and trauma that sent Māori into a descending decline in health outcomes, disparities and inequities, it brings us back to the Te Tiriti o Waitangi. Māori chiefs and the British Crown worked in pair to negotiate an agreement that would protect their undisturbed land and provide protection, which was signed on the 16th of February 1840. Cam et al. 2020. It was soon discovered by Māori that the Te Tiriti and the English translation of the treaty did not align accurately in context, and is the main cause of confusion between what the Māori intended when signing it and how the Crown interpreted it. Cam et al. 2020. Because of that confusion, it is well acknowledged by the Māori community and a huge contribution to the distrust they now feel towards the health system, that the agreement was not honoured by the Crown. The Crown understood it as a cession of sovereignty that would allow them to gain superior authority over the Māori and their land. Cam et al. 2020. Sovereignty is extreme power which the Crown used to suppress the Māori's non-westernised beliefs and way of life that differed from their own, to benefit the colonial project. This led to the following acts that contributed to the systemic racism Māori had to endure. In 1867, Parliament passed the Native Schools Act favouring the English language in education to distance Māori from their culture and identity. And in 1907, Parliament passed the Taonga Suppression Act, which made traditional Māori healing methods unlawful. Wynyard 2019. According to Stephens 2001, it was used to suppress Māori's beliefs in the supernatural cause of healing of disease. An article written by Wynyard 2019 also discussed ways that the land was taken away from Māori, such as methods of rūpatu, which is confiscation, and the Crown's overpurchasing and compulsory acquisition. Wynyard 2019 stated that Māori who have deep cultural whakapapa connections to the land were left culturally, materially and spiritually impoverished. Page 162. Māori owe the beginning of their devastating health outcomes to the arrival of Pākehā with their foreign diseases. The Māori population was at an all-time high of 150,000 before Pākehā arrived in 1969, introducing diseases tuberculosis, pneumonia, and influenza that devastated the Māori population to 42,000 by 1896. Wynyard 2019 stated that Māori who have deep cultural and whakapapa connections to the land were left culturally, materially, and spiritually impoverished. Page 162. Māori owe the beginning of their devastating health outcomes to the arrival of Pākehā with their foreign diseases. The Māori population was at an all-time high of 150,000 before Pākehā arrived in 1769, introducing diseases tuberculosis, pneumonia, and influenza that devastated the Māori population to 42,000 by 1896. Then the land loss, having to move further out to unfamiliar land due to the arrival of Pākehā, as well as the suppression of Māori culture and beliefs. Whitireia 2011. The Crown's actions against Māori after the Te Tiriti was signed is viewed as a major breach of the Te Tiriti. Cam et al. 2020. Despite petitions beginning in 1867, when the first Māori leaders were voted into Parliament, Cam et al. 2020, with the increased consciousness and awareness, it was finally investigated in 1975 by the Waitangi Tribunal that was established due to the Treaty of Waitangi Act. Hun Maturata, Minister of the Lands and Māori Affairs, introduced. Ruru and Koea Morris 2020. The Waitangi Tribunal had a responsibility to view Māori claims regarding the Crown's inconsistencies with the treaty's principles and hold them accountable to amend them. Ruru and Koea Morris 2020. The Act worked hard at trying to amend the systemic issues created by the Crown by developing Māori health policies that fit these 5 fundamental ideas. Compliant with Te Tiriti, recognises rangatiratanga, ensures accountability to Māori, ensures that investment in Māori health is correspondent with equitable outcomes, and embedded equitable and non-racist practices in policy development, delivery and evaluation. The effects of the Act began to show in the 1980s through policy thinking, Māori assertion of rights, and an example shared by Cam et al. 2020 in the article Implications for Decolonising Health Systems. It mentioned that the health sector was led by the Director General in 1988 to take on the treaty's obligations by acknowledging the health as taonga, which stands for treasure and partnership. Despite this progression in healthcare, the failure of the colonial system still seeps through, showing in the distinctive health disparities still present between Māori and other New Zealanders. Cam et al. 2020. It is undeniable that there are still inequities in healthcare. However, disparities are consistent across various social indicators for Māori, including education, housing, health, and income, indicating the reason isn't isolated to one reason, but instead a result of many social barriers such as systemic, institutional, and interpersonal racism, colonisation, economic and social reforms, urbanisation, access to appropriate health services, and health workforce bias. Barton 2018. It is undeniable that there is still inequities in healthcare. However, disparities are consistent across various social indicators for Māori, including education, housing, health, and income, indicating the reason isn't isolated to just one reason, but instead is a result of many social barriers such as systemic, institutional, and interpersonal racism, colonisation, economic and social reforms, urbanisation, access to appropriate health services, and health workforce bias. Barton 2018. To share more on the statistic comparison, Māori are more likely to die 7 to 8 years earlier than non-Māori. Māori are likely to die of preventable diseases. Māori hospitalisation rates for asthma have remained consistent but decreased for non-Māori. and bronchiectasis and bronchiolitis in Māori children 0 to 14 are 6 times more likely to be hospitalised than non-Māori. That number has increased over time, and chronic obstructive pulmonary disease, aka COPD, has increased in hospitalising more Māori than non-Māori, reported by the Ministry of Health 2019. And that is just to name a few of the disparities in certain diseases. Those are just to name a few of the health disparities among certain diseases. Diseases such as cancer and heart disease have a longer survival rate if treated with the necessary health care, but Māori survival rates are short once in contact with these diseases, indicating lack of access to health care and treatment at efficient time. Reported by Rochford 2012. It is worth mentioning that the Māori health statistics have improved in some areas, such as cardiovascular disease, but New Zealand is still working out of the stance that everyone has a right to equal health care. However, Māori are already extremely disadvantaged from their past with the Crown and their overrepresentation of poor health statistics, and therefore should be appointed more supported healthcare than other demographics of New Zealanders. Reported by Whitireia 2011. Change can happen to accomplish closing the gap between Māori and non-Māori if there were more effective health models, frameworks and programs that aren't tailored to mainstream health processes that are clearly not working or effective but interpret equity. Whitireia 2011. Upon exploring the deep-rooted complexities of the Tiriti and colonisation and how they have contributed toward the downfall of Māori health outcomes from systemic racism, theft of land, suppression of language, racist policies and discrimination, it has provided the insightful knowledge that the healthcare system has neglected Māori for centuries due to the many barriers that Māori have faced and are still facing, causing Aotearoa to still deliver poorer than average healthcare outcomes for Māori. Understanding how Māori patients and their whānau perceive their experiences in healthcare in Aotearoa is a key tool healthcare professionals can utilise to alter and improve their practice to provide better care for Māori patients, encouraging the use of healthcare facilities to help bridge the gap between Māori and non-Māori health disparities. Understanding how Māori patients and their whānau perceive their experiences in healthcare in Aotearoa is a key tool healthcare professionals can utilise to alter and improve their practice to provide better care for Māori patients, encouraging the use of healthcare facilities to help bridge the gap between Māori and non-Māori health disparities. First, it is helpful to have insight of the main Māori model of health to understand how Māori views on health differ from westernised healthcare, which is accepted and offered in healthcare facilities in New Zealand. Purdy 2020 explained that Te Whare Tapewha translates to a four-walled house that represents the four components of an individual: spiritual health, mental health, physical health and family health, and they all stand upon the foundations which represent the whenua, which is the land and roots. These aspects rely on each other to make an individual complete and balanced. It is believed that if one or more of the walls is compromised, it causes an imbalance in a person's life. This model of health promotes the care and attention to the whole person, that understands poor health to be caused by a problem with one of the four walls, and works to fix it from the inside out rather than masking it with westernised medicines. In a study done by Graham and Masters 2020 called Experiences of Māori of Aotearoa New Zealand's Public Health System, Māori patients and their whānau's experiences from the last 20 years are dissected and categorised into 3 important barriers that cause them to feel negatively about their experience with the healthcare they had received. The first one being organisational structure. This is described by the hostile and cold reception Māori have experienced from healthcare workers, from the way they mispronounce their names to their body language. These actions caused Māori to feel they were not being genuinely cared for and were discriminated against. Due to Māori's beliefs of health, it underpins a layer of distrust in healthcare workers because the questions and care have no relevance to their spiritual or mental well-being, only physical. Māori have a strong sense of awareness of the negative perceptions that have been installed in some, which makes it even more crucial to remove workplace biases and provide high professional standards when caring for Māori patients. The next category is staff interactions. It talked about how healthcare workers were not skilled in creating a comforting, safe environment for their patient, unsuccessfully building rapport. The cause of that also includes inconsistencies in the staff that a Māori patient sees when they book an appointment, so different staff members that they may be seeing compared to other times. This leads to problems with Māori patients opening up, feeling comfortable to ask the necessary questions, one patient admitting that she was too frightened to ask questions, or they have to repeat themselves to each different healthcare professional they have to see, creating negative feelings and feelings of avoiding healthcare. Last is the practical barriers, the cost of healthcare, whether it's the cost of medicine, a babysitter, work leave, the cost of an appointment. One participant mentioned that the cost of an appointment at a doctor's or a GP was half of their food money for the week. Doctor's availability or unavailability creates a problem for the non-flexible patient if someone's trying to get leave and they can't get leave at the time that the doctor's available. Healthcare isn't made easily accessible to the lower income Māori families. These barriers alone cause the avoidance of going unless it is absolutely necessary. As you can see, there's still a lot of room for work for improving Māori health experiences in hospitals and healthcare to encourage the use of healthcare. It is important for a nurse to removing any workplace biases and using skills and strategies to make that person's experience better. Rangatiratanga is a part of Article 2 in the Te Tiriti o Waitangi, our founding document. It is a traditional Māori concept of practicing independence, governing one's own life decisions and exercising Māori worldviews while having them validated. It represents leadership, autonomy and sovereignty in health policy development, Cam et al. 2020. This concept has been gaining acknowledgement and is slowly coming closer to being applied into the health system to better meet the needs of Māori patients efficiently. However, it hasn't been implemented effectively so far, as Māori are still experiencing average healthcare and outcomes. An example of potential application of rangatiratanga in public hospitals is rongoā, which is a Māori traditional way of healing that involves natural treatments from the earth, such as certain foods and medicinal plants. A survey done by Koea and Mark 2020 on the Whitireia District Health Board asked about their attitude towards rongoā being applied into the hospital system, with over a third of the results showing that they were supportive at making sure it should be available to Māori patients. In a statement presented by Rongoā Māori and Complementary Therapies in Nursing Practice, NZNO 2011, regardless of whether a nurse chooses to utilise complementary therapy in practice or not, all nurses have a responsibility to be aware of the implications of complementary therapy for those who choose to utilise these as part of their healthcare. This may include providing resource material, education, and or referrals to qualified practitioners. Page 4. This is a helpful strategy if implemented correctly. However, it isn't efficient if their knowledge is not equipped with the correct information, and from the survey done by Koea and Mark 2020, over half of the 1,181 participants from Whitireia District Health Board hadn't even heard of rongoā, proving that it cannot be implemented in the hospital system efficiently if staff do not have the knowledge themselves. To be implemented better, a cultural holistic approach combined with mainstream healthcare would better improve Māori hospital healthcare and implement rangatiratanga. According to the article by Koea and Shepherd 2020, there is research and increasing evidence going into the potential of genetic variants causing different effects on ethnicities when taking mainstream medicines such as metformin to treat type 2 diabetes, which has been addressed in anecdotal reports. Māori and Pacific respond worse to metformin. The study suggests the unique genetic factors such as the CREB BRF gene that is only found in Māori and Pacifica could have different impacts on the generic stepwise rubric for medications. It opens up the possibility that genetic factors could play a role in the poor Māori health outcomes from the one-size-fits-all westernised healthcare provided in New Zealand. Potentially, rongoā and other complementary healing techniques that have been used by Māori for generations could benefit their ability to process natural rongoā and provide positive results in comparison to chemically complex westernised drugs. Hopefully, with primary healthcare services moving towards being Māori-led, it will positively affect the implementation of rangatiratanga in hospital healthcare and improve the cultural issues faced by rongoā and inequities rongoā practitioners have in comparison to mainstream health in New Zealand to cater to the needs of Māori patients better. Koea and Shepherd 2020. I have gained extensive amounts of knowledge and understanding with regards to Māori and what they have endured since the arrival of the British Crown during the creation of this learning resource. My empathy and strive for better Māori health outcomes will be at the forefront of my work as a nurse in Healthcare New Zealand, and I plan to continue growing and learning more about Māori health practices so I can be better as a nurse. Being able to now understand how impactful the holistic side to health is to Māori and how it significantly contributes to Māori relating and being able to gain more trust in the primary healthcare system, I'll implement my knowledge of the holistic side of health by asking questions that relate to the Māori models of health like Te Whare Tapawha, addressing the mental, spiritual and family well-being of my patients, not just the physical well-being. Purdy 2020. I will take the time to learn the information for Māori practitioners who practice traditional Māori healing so that I have the ability to refer my patients who wish to access it. I will also be knowledgeable in the necessary information to refer my patients to translators in case of any language barriers, and I will take my time to pronounce their names correctly and explain information regarding their health and not rely on pamphlets covered in overwhelming information, as I now understand how important communication needs to be to build positive rapport with my patient. Thank you for listening to my presentation. I hope you learned something.